Welcome everyone. We're here for the official road ribbon cutting. We are at Mount Vernon High School, and this is for the ribbon cutting for Nationwide Children's Hospital School-Based Health Center. Is that exciting or what? Let's give a round of applause. On behalf of the Knox County Chamber of Commerce, we certainly congratulate you on this endeavor. I can't imagine all of the people involved. Very exciting day, kicking off the ceremony. Very pleased to introduce the mayor for the city of Mount Vernon, Dr. Matt Starr.
Thank you, Carol. I'm looking over at my colleague over here, our health commissioner, and he and I know all too well just how important access to health care is in this community. We have many initiatives for social determinants of health, and we work with Knox Public Health, the Knox Community Hospital, the educational institutions, even our street department and our cities looking at our transportation access to health care. And so having this partnership with the city school district and Nationwide and the health initiatives that we have, this really checks a lot of boxes. And it's great timing because we're very close to launching our next community health assessment led by Knox Public Health, and following that, the Community Health Improvement Plan. So I can't think of a better way to set this next assessment off than to cut the ribbon for this wonderful service that we can provide our kids.
Thank you. Thank you so much, Mayor. I also have some proclamations I'd like to present to Superintendent Bill Cedar. The first one is from Ohio Secretary of State, Frank LaRose. And certainly it is his privilege to recognize today's ceremony and this accommodation for the wonderful impact that you're going to have for so many citizens in the Mount Vernon School District. So it's my pleasure to give you the proclamation from Frank LaRose. And the second one, very happy to have a proclamation from Congressman Troy Balderson. And he said the Mount Vernon High School Health Center will provide quality medical services to students, allowing them to remain happy, healthy, and focused on their studies. Just one, I think, very important message in his proclamation. So very pleased to pass that to you, Bill. And with that, would you please share a few words with us about today's wonderful new health center?
Well, this is really an exciting day. I can remember, quite frankly, 3 years ago, I came out of a meeting with Zach at the Knox County Health Department. We just looked at our health survey results and some of the student information that came from there. And we just started saying, wouldn't it be great to have a school-based health center? We didn't know a lot about it, didn't really know exactly what it looked like, but one meeting led to another meeting, and then all of a sudden, some local Knox County folks with Zach and others, we headed down south and we got to see a school-based health center for the first time. And we walked away from there just incredibly excited at the opportunity, but we just still had some barriers. Number one, we had to sell that vision. Number two, we had to find a place and a way to afford it. And then we'd never run a school-based health center before. And I can just tell you, the board, when I met with the board, they were just incredibly welcoming to the idea, understood the vision that was there, and they kind of green-lighted it to take another step. And we have some of those board members here today, and I can't thank you enough for sharing in that vision. The next piece, which was critically important, was we went to these places and they were beautiful, but how in the world can we afford something like that? I mean, they were impressive. And lo and behold, as the stars kind of align, as they say, Governor DeWine came out with a really neat opportunity for school districts, a $500,000 grant to implement a new school-based health center. The caveat to that was you really needed to partner with someone who has been involved in this work for a long time. Bruce White at Knox Community Hospital said, hey Bill, I think you ought to talk to Nationwide Children's Hospital. And what a wonderful suggestion. I started meetings with Teresa and Matt, and Teresa's here. That meeting led a meeting with Sarah, and then it just started going on down the road to a point where we applied for that grant. We received it. We brought in our architects, Fanning and Howie, and Dan O'Grimba's here today. We started going right at all of the development of those things, and we were hearing that lots of other school-based health centers were kind of, it's tough to get started. And we were blessed to work with a local construction firm, Modern Builders, and they're here, and Jason and his crew. And I'll be doggone if we didn't start this in October, and here we were, we got to May, and we worked through this process to open up this facility that you see here. What I didn't realize when we joined with Nationwide Children's is I didn't just join with Teresa or Matt or Dr. Bodie, but it was a team. Colleen was walking us step through the construction process. We've got some wonderful folks right here who are now manning this facility. And so just the thought of what this impact will be for the students of Mount Vernon as we move forward. Middle school's right there, the high school's right here. There's 2,000 students right there. We've got the Career Center right there. There may be another 800. We're talking to MBNU. We've got all of our elementaries. The impact that we can make on student health care is just incredible. And again, we want to be partners. I know Nationwide has been so forthcoming from the beginning. We're not here to replace any primary care physicians. We're here to just support what's going on, and we have a lot of needs. And so we're really excited that we partnered with you all, and we look for a great relationship.
Thank you so much. A wonderful story. I really appreciate the background. And again, it takes many people to make something like this happen. So it's my pleasure to introduce the medical director of Nationwide Children's Hospital School Health Services, Dr. Sarah Bodie.
Thank you. So, as Bill said, this has been a journey, and we're just so excited to finally be here today and be able to celebrate with all of you with this school-based health center. Why do we do this? Why do we think about bringing health services into schools, and what's that really all about? What does that mean? And what we know at Nationwide Children's Hospital is that over half of students that attend school in the state of Ohio do not have a medical provider. They don't have a medical home. And they really have limited access to services. So they have unmet health needs, whether that's behind on immunizations or their well care or their asthma or other issues that they're having. And so by thinking about how we improve access and bringing services into the school, we can really work together to close some of those gaps and make sure that kids are ready and are coming to school healthy and ready to learn. Why do we care about that as a healthcare entity? Because we know that education is really the most important social determinant for kids about where they can go next, how they can meet their potential and become a healthy, happy adult. And so we really want to partner because both health and education together and meeting both of those potentials is really a game changer for our students as they grow up and for all of Ohio. And so we're really excited to be able to partner. We have a great team here, and I'll introduce them in a minute, that's going to be providing services on site here. And we really couldn't do this without, again, the community. We're thankful for Governor DeWine, as you mentioned, for really prioritizing this and thinking about some funding opportunities. All of our elected officials that have supported this along the way. It's really taken the entire state to prioritize school health and be able to, again, bring these services. It's not easy, as he mentioned, thinking about all the parts and pieces and steps, and so there has been a whole team along the way that's been able to make this happen. But right now I'm really excited to introduce Lori Schuler. So she is the nurse practitioner that's working in our school-based health center here and is a member of the community, and she can talk a little bit about the services we're going to be providing to the students.
Thank you, Dr. Bodie. I think it's wonderful to celebrate this opportunity with the community which I live in and love living here. And I just wanted to kind of tell you a little bit of what we can provide here. All of you know how important a school nurse is to the school. You may have gotten a call that your child was sick or injured at school. Our goal with school-based healthcare is to partner with the school nurse to provide other services to growing needs of children who have needs, such as well child care, immunizations, sports physicals, sick care, asthma and diabetes management. We also found through our other centers that about 70% of the students had not had a well child check in the previous 18 months. And so we know it's important to be seen annually, so we're trying to capture that as well. We look forward to making an impact on the Mount Vernon area by keeping the kids healthy so that they can stay in school. And I would just like to say thank you to Lane Shoemaker, who is the Mount Vernon District School Nurse, for her support, and we really look forward to the partnership. Yeah, turn it back to you, Carol.
Thank you.
You're
Thank you,
welcome.
Dr. Brady. Thank you, Lori.
Yeah.
Again, just a wonderful story. So glad to have the official ribbon cutting today. So if you're ready for your ribbon cutting, Paul has the scissors. So everyone, please step up and grab a hold of a piece of the ribbon. I want everyone to help us count down 3, 2, 1, and they will cut on 1. So is everyone ready? 3, 2, 1. Congratulations. Thanks, everyone. Please come in and tour the facility.
Bill?
Thank you.
If anyone would like to come in and take a tour, we have some refreshments and would like to meet you.